a large number of our population here in New Mexico. We have about over 2 million people, but it's about 282,000 New Mexicans face hunger every day. And again, there are government programs that are here to help them, and there is some charity out there as well. But as we know, as we go to the grocery store, the price of food is more expensive than ever we've seen. And we're going to talk about how that affects hunger in our state. So these are important things that face us all, and who knows better than our folks are with Meals on Wheels, a program that feeds the needy in Albuquerque. We have Dennis Plummer. He is the Chief Strategy Officer with Meals on Wheels. Thank you so much, Dennis, for being on this program, for all you do in our community.
Thank you, Diane. I really appreciate you having us here today.
And Shauna Frost is the CEO for Meals on Wheels in Albuquerque. Thank you so much, Shauna.
Thank you.
Shauna, you know we're going to have other programs discussing Meals on Wheels, specifically what you do, how you deliver food to the needy, to the hungry. But we're here on this show today to talk about the stats, the statistics. And I'm going to put you on the spot, Dennis, starting with you.
Sure.
Not blaming you, because you're here to help with Meals on Wheels,
Right.
but #1 in the nation for child hunger, #6 in the nation for overall. I think we have 41% of our population on that supplemental SNAP program. Why is New Mexico so poor in this area of hunger?
Well, I want to answer that, and I also want to drive home the point that you made so well, which is how serious of a problem this is. And by looking at another social issue, which I think a lot of us have in mind, that the crisis of homelessness in our community is pretty severe. I think most people would agree. And yet, for every one person experiencing homelessness, 87 people are experiencing food insecurity. So
we see,
right?
I think your point is, Dennis, we see the homeless in our streets.
Exactly.
We don't see the hunger.
Right, the hunger is behind doors at people's homes. And yet if you do the math on your way home today, every person you see on the street, add or multiply times 87, and that's what we're looking at. And by food insecurity, I think it's important. A lot of these definitions get tossed around, and what does that mean? Food insecurity is really low or very low security of food, meaning I'm either buying material and food that's not nutritious, so fast food because it's cheap, or I'm skipping an actual meal. I'm going without food. And that's what we're looking at. That's the crisis here in New Mexico.
The security part. So, Shauna, they might not be hungry because they have this inexpensive fast food, but they are still insecure with food.
And when people start to primarily rely on poor sources of food, you start to get into serious medical issues, which increases the cost of medical care, both for the individual and for the state and for the federal government as well. And it's this really bad cycle that people can get into simply by trying to survive on the money that they have.
So the insecure part again, Shauna, is interesting because I always thought it was the hunger, but it's just they're not getting the nutrition.
Absolutely.
That we all need.
Absolutely.
The correct nutrition?
Yes, yeah. There's, very clear guidelines on what makes a healthy diet. Meals on Wheels, we've been delivering 8 different types of medically tailored diets that are specific for different medical conditions for the past 51 years. But if you can't afford to be able to buy fresh fruits and fresh vegetables, if you live in a rural area or a food desert, you might not be able to obtain those things. If you're experiencing a medical crisis, you might not be able to prepare those foods. And so there's a lot of things that go into what might make somebody food insecure, money being one of them, but there's a number of other indicators as well.
And Dennis, you mentioned, again, the food insecurity. I didn't realize that it was just because they're eating the fast food, but because it's cheaper, but also it is convenient, and Americans tend to like the quick, everything's quick these days.
And it fills you up more too, right? If you have 50 cents to buy something, will you buy mac and cheese or will you buy broccoli? Broccoli's better for you, but that 50 cents is not going to go as far to make myself and perhaps a child feel more full. So you end up buying things that are less nutritious, but feel more filling.
How long have you been with Meals on Wheels as the Chief Strategy Officer, Dennis?
I've been with us for a year and a half.
And prior to that, what did you do?
I was a CEO for Heading Home for 15 years, and that's
Okay.
a housing and homeless agency. That's why I use the illustration. Moving over, I was so startled and surprised by how much food is such a troubling source of many people's medical needs in New Mexico.
What message would you like to get out that perhaps our viewers don't realize, that I don't realize? I mean, you work in this industry,
Yeah.
you and Shauna do,
You
and
know,
you see it every day. But what do we not know that you know? What do we not know that you know?
You know, over 50% of our state is, if you're in a rural area, further than 1 mile from a healthy grocery store, oftentimes without transportation. And in rural New Mexico, it's over 20 miles away from a grocery store that has proper nutritious food. And that was really startling. And in rural New Mexico, traveling, especially if you're elderly and in a home, getting to that nutrition that is there, that's the part that I think is encouraging. There's a solution. We have food, whereas in housing and homelessness, there's really not the market with housing, even if you can afford it. We have the nutrition, we have the farms, we have the local food. If we can just get the food to those people who have that need. And we have so many of these, what are called food deserts, which is not being able to access that nutrition. So it's something that's solvable, which I love.
But what's interesting in the research that I had done, if you can believe everything you'll learn online, it said according to the U.S. Department of Agriculture, the lack of fresh, healthy foods in Albuquerque is most apparent in two neighborhoods. One is the South Valley, and one is the Urban International District, which is along Central and I think San Mateo, around that area.
Yeah.
I mean, those are like right in the city.
Right.
So why would those be considered maybe the desert?
It's oftentimes because, unfortunately, these social issues hit minority populations more severely. They have less access to transportation. If they're able and have transportation, they may not be able to leave their home. And so even if you drive down that area in Central, Walmart we know just closed, which was a major source of food. So you have a lot of fast food restaurants, but again, it's about proper nutrition.
It's about proper. Shauna, sharing this question on this particular program, Fighting Hunger, and the huge ranking that we have, what would you like to tell our viewers and to tell me, something that people are surprised when they hear it?
You know, my biggest piece is the people who are hungry are your neighbors. It doesn't matter what kind of a neighborhood you live in. You could live in the South Valley. You could live in the North Valley. You can live in Rio Rancho. You could live in an affluent area or an economically depressed area. You have neighbors who are hungry, and you don't even realize it because it's behind closed doors. We call them the hidden hungry because it's not something that's in your face. And for Meals on Wheels, a lot of it is about access. Money is only one piece of the access. Money can prevent people from buying food, but even if you do have money, you still might not have transportation. You might not be strong enough to stand up and prepare food. All those things contribute to somebody being hungry. And so when you look around your neighborhood, how many people are behind closed doors and not eating? And that can be a really scary thing to think about.
Now, Shauna,
Yes.
I'm supposed to trust you that you know this. You're saying our neighbors, we may not realize, I don't realize this.
You know,
They're actually hungry, or they're insecure, eating the wrong thing. Which one?
It could be both. It could be one or the other, or it could be both. They could be hungry and they're just getting what they are able to obtain. So ordering pizza. Pizza comes to your door. You don't have to cook it, something like that. So somebody who might have funds but might not be able to prepare meals might be ordering, I mean, that might be their primary diet is DoorDash and pizza delivery and things that aren't necessarily going to be the best things to help keep them healthy.
To keep them healthy, that is
Yes.
the key. They're getting the food,
Yeah.
but it's not healthy.
well, and a piece of this that Shauna's alluded to is the aging population. So I may have money, But if I have Alzheimer's and I can't remember to turn my stove off, I can't prepare my meal. Or if I'm not able to stand, as Shauna said, and New Mexico is projected by 2030 to be in a three-way tie for the oldest population. So our state will be tied with Wyoming and Maine for the oldest population. So this is going to exacerbate, right? We have elders at home who may have money, who can't prepare the food that they need to get.
You had some other statistics and points that you wanted to share about, again, why are we so bad? Because we're such a large state.
That's a
I mean,
the rurality is hard.
Fifth largest land mass.
Yeah.
Why? Now, Meals on Wheels is primarily for Albuquerque or statewide?
So we are now statewide. So you'll see we are Meals on Wheels New Mexico. We're serving seniors in Las Cruces. And we also are serving, this is a great partnership, we're serving all of the student population at Luna Community College in Las Vegas. That's a partnership with the college there. So the students who are barely scraping by to make their tuition can now have a nutritious meal every day. So we're looking at all ages. So aging is one thing, but also just having the money. If I want an education, I'm investing in my education and probably eating ramen noodles every day.
Now they're not.
Now they don't have to, exactly.
We're going to have other programs with Shauna discussing Meals on Wheels, but again, just since we're bringing it up and people are saying, why isn't Diane talking about Meals on Wheels? Just we'll have other shows, but tell us if we piqued their interest on that. How can they receive some information on Meals on Wheels, Shauna?
They can visit our website, mow-nm.org.
Repeat that again.
mow-nm.org. They can go online, they can learn how to receive services, they can donate, or they can volunteer. We're always looking for volunteers as well. They can be part of the solution.
Very good, thank you. Getting back to our horrible numbers, have we seen them, I mean, you can't get worse than being #1 in the nation for hunger among children. Are we seeing any improvement, or is the situation actually getting worse?
Well, Diane, I'm excited. There's a lot of collaboration among nonprofits, government, and business community to solve this. I think we've all seen New Mexico has plenty of food, and it's good food, it's nutritious food. And so these groups are coming together on a regular basis over the last couple of years to collaborate to say, how do we get the food from the farm to the table in a way that's prepared, that's nutritious and edible for people who may have challenges, as we mentioned, preparing the meal, or need a medically tailored meal, something that's renal friendly or diabetic, so that the nutrition is appropriate for that family. So there's a lot of collaboration. We won't know for another 5 years probably, but I think the needle will move with this great sense of we can do this together.
And again, we're an agriculture state.
Right.
Energy is one thing. We've got plenty of energy that's supporting a lot of our budgets, but also agriculture. It's just getting it to the people and having them being able to prepare. And of course, if they're not able to, I know we have Meals on Wheels to do that.
Right.
Tell me a little bit more about the state. I said maybe because we're such a large state. Why else are we so poor in these numbers?
It really is that, I think, and poverty mixes in with that. So the cost of living, the minimum wage, all those things combined to where I'm really trying to stretch my dollar. And I think some of the stats you saw, a lot of people are having to make choice between, do I pay for transportation? Or
Tell
do
me
I
about
buy
those
food?
stats. You have those.
Yeah, some of these,
And this was a study that was done by?
At the Santa Fe Food Depot, one
Okay.
of our major food banks, did a study, and they released this last fall, and 61% of people are choosing between paying for utilities, keeping their lights on, or buying nutritious food.
And what do you mean 61% are choosing? They have to choose. They have to choose between?
Right. If I have $1, do I keep the lights on or do I buy dinner? This is what they're having to face. So that's where we're trying to stretch the dollar. So it's a lot of factors together. We're focused very much on getting the food and nutrition to people who need it, but it will take a community, and that's where I am encouraged that people are looking at solutions.
But they also have to make a choice between their utilities, their transportation. What else do you
Yeah,
have there, Dennis?
66% are choosing between transportation and food. 59% getting medical care that they may need or buying food. And so all of these things are things that you and I oftentimes don't have to think about, but imagine the stress that adds on top of just in a day deciding where am I going to spend my $10. Am I going to eat healthy or
This
move
day and
on
age
to
with the
something?
price of fuel, gas, I think people are not choosing, but deciding, do I really need to run to the store today, or should I combine it with running to the library and to paying my other bills, and combining all that? We're needing to become a little more savvy in how we use our transportation money because of the
That's
cost.
true.
At least
Very
I am.
much
I'm
so.
thinking,
Right.
do I really need to do that?
Right.
And when you have rural areas, the cost of transportation really increases because you have to go so much further to be able to do those things and go to those places. And when you are in rural areas, unlike when you're in an urban setting, you know, you might spend 5 minutes going from the doctor to the grocery store. When you're in a rural community, that's now 20 or 30 minutes between each thing. And so really those choices become even more important for those who are outside of city centers.
You were, I know you like discussing, Shauna, and we're going to talk to Dennis about the choices that we make, what kind of food we eat, but we talked about food as being medicine. And, you know, people are eating, we see the fast food on every single corner. Americans like their fast food.
I do. Right?
It's delicious.
But not all the time, right? And that's what some people are facing with. 75% are having to choose unhealthy meals because, as I mentioned earlier, it fills you up, it makes you feel full, even if it's lacking the nutrients that you need. And the nice thing about a Meals on Wheels program is, as food is medicine, as you mentioned, people on this are seeing a reduction in hospital readmission. They're seeing their health outcomes improve. So getting nutrition up front to reduce the number of times somebody goes back to the hospital, think of the overall savings that we have if we can just work upstream.
Yeah, in our program alone, when we do comparisons before program, being on the program, and after being on the program. And just in our client population alone, we've seen a 33% decrease in the number of times a client has had to go to the doctor because of an emergency.
Yeah.
What's going on with our kids?
That's one thing I like about Meals on Wheels New Mexico is we do not have an age limit. We serve anyone. As I mentioned earlier, we're doing the college students in Las Vegas. We all need nutrition. And the earlier we start training children what tastes good, what's healthy, if we start building these habits early on, that's going to impact generationally.
But I know in the public schools here in Albuquerque, I believe we provide breakfast, lunch, take-home backpacks, maybe even for dinner and for weekends.
And that's just really, I know we're first in the nation to make that free for all, breakfast and lunch, anyone. And it takes away that stigma of having to eat this special food and my parents can't afford it. Now that stigma is taken away. It's free to anyone who wants it for breakfast and lunch throughout the state. And that's all part of this collaboration I was mentioning, where we're really looking to use New Mexican grown products, and they're getting that into the school. Meals on Wheels New Mexico, we have at minimum 20% of our product is bought locally. So we're buying from Silverleaf Farms, we're buying from our neighboring meat growers, and we're using that and teaching kids early on, this is in your backyard, this is how you grow it, this is how good it can taste. That's going to build generational change and improve that needle and that number that you mentioned earlier.
How many new, I think the number's growing, you've heard, well, because the price of food is so high. People, 19% now are trying to grow some fresh food themselves,
Right.
Chuck?
Yes, correct. Yeah, backyard gardening is taken off, and that's great. I don't happen to have a green thumb, so that is not an option to me, but it is an option to many others. But then you get into going back to this food as medicine connection, you get back to the people who are unable to grow their food in their backyard, and then that becomes not an option for them as well.
Again, the food as medicine, there are 10 common chronic conditions for adults 65 and over, Dennis. Tell me a little bit about them and how they're affected by food.
Yeah, you know, food is medicine. It's taken off, I'd say, in the last couple of years, where people are really recognizing it's a lot cheaper to feed somebody healthy food than, 58% are experiencing hypertension. We have 47 with high cholesterol.
Wait, 58% of our
Population.
adult population?
This is 65 and plus.
Oh, 60, right.
Yeah. And as I mentioned, we're going to be one of the second oldest states in the country. So all these medical conditions will naturally increase with age.
So let's go a little slower for those who are 65 plus. 58%.
Will have high blood pressure.
Okay, and
And-
that's I mean, you can regulate it with low salt diet, low sodium diet.
Right. So we have one of our menu options is a heart healthy, and so you can control that rather than going to the doctor and being on meds and having a high medical bill, paying less than half of that for healthy food.
And then out of the adults 65 plus, just here in New Mexico, 47% of high cholesterol.
Right.
We know that can be regulated with food.
It's all food, right? It's all food.
Oh, it's all food.
Yeah.
Oh.
And 80%.
What?
Of this,
Wait.
yeah.
Wait. 80% what?
80% have at least one of these conditions that we're talking about.
Oh.
And 68% have two or more. So it's not just, oh, I only have high blood pressure. It's likely I have high blood pressure and arthritis.
Well,
Or
what about arthritis? Can that be affected, Shauna, by food?
I believe so.
31% Dennis has that.
Right.
Wait, tell me about the arthritis.
So the arthritis, you can't totally reduce everything by food, but imagine a healthy meal
Okay.
leading into all of these things. And arthritis, I actually don't know the exact connection to it. It's
But
just,
of course, we
I was
know
looking at-
diabetes, 27% diabetes,
Yeah,
of course.
in Crucis, we were offering any of the medically tailored meal, and 47 out of the 50 new clients down there asked for the diabetic option. Because our senior centers can only offer one meal plan. So even if you're getting home delivery from perhaps a government agency or a congregate meal site, it's not a diabetic option. And so we're coming alongside, again, collaboration and working with entities to say, we could also offer you a renal friendly, low in phosphorus. We can give you a diabetic menu, things that people, even if they can cook, don't necessarily know how to prepare. We can also do a pureed option if you have difficult chewing. We can do mechanical cut, so dice size or rice size. All of these options are building, and it's not things we normally think about,
People are
right?
thinking, I want to know more about Meals on Wheels.
Yeah.
Tell them where to go again, the website, and how much does the program cost?
So the website is mow-nm.org. We work on a sliding scale because, once again, access is very important to us. And so based off of what the client's monthly income is, we have meals that could potentially be free.
Okay.
Yeah.
Dennis, you brought another chart that you wanted to talk about that I'm holding up.
So many stats. I love data,
He
right?
likes data.
I like to do what feels good, but I also want to know that it's doing good, right? And so this is actually a study that was done by Brown School of Public Health. And so the university was finding that on a 30, 90, and 180 days of being on a Meals on Wheels program, they wanted to know what happens to people's medical conditions. They found a 28% reduction in nursing home use. So imagine the dignity of your relatives being able to live at home longer because they have good medical, nutritious meal. After 180 days, it was still a 25% reduction in nursing home use, just because they're on a Meals on Wheels program. There's a fascinating study also from Brown University that shows a reduction in the number of times people fall in their homes just because they're on a Meals on Wheels program. And it took me a while to get my head around that.
Right?
But if I have to stand and prepare my own meal, move around the kitchen, I'm more likely to fall. And it had a 33% reduction in falls based on just having a meal delivered to your house.
Very good.
Yeah.
Anything else? We got just a minute left, Dennis. Thank you, Dennis Plummer, the Chief Strategy Officer for Meals on Wheels.
Yeah.
Final note to folks.
It'll come up in your other programs, I hope, but we need volunteers. This only happens through a network of community. And so we invite anyone to come on board with us and to help get this nutritious meals delivered to the people in need.
I understand we have the need out there, but the volunteers to get to the need. Shauna, you're going to be back with us, Shauna Frost, the CEO for Meals on Wheels, to discuss the volunteers, how people can apply.
Yep.
You still want people to be a part of the program, but you sure need the volunteers to help,
Absolutely. Yeah, people can be part of the solution.
because it just can't be you two, right?
Right, a lot of cooking.
And a lot of driving.
Right.
How long have you taken the state? And the program's been here 50 years.
Yeah, yeah,
Yeah.
absolutely. We've delivered about 5 million meals so far. Yeah, in those 50 years.
It's a lot of.
And more to go because we're aging as they. Thanks for
Right,
pointing that out,
reminded-
Dennis.
we're all
it's just
getting
not
there.
us.
Right.
It's the whole state, so that should make us feel better.
Yeah, we're in good company.
We are. Dennis, thank you so much, Shauna. Thank you. We'll see you again. And thanks for watching this program. I'm Diane Kinderwater. Make it a great week with your family. We'll see you next time. Bye-bye.